Retinal detachment is alarming ocular emergency, where the retina, which is the thin layer at the back of the eye, separates from its underlying support tissue. When this occurs, the retina is deprived of oxygen, and if left untreated, causes permanent vision loss. What is the most important symptom of retinal detachment? It's a sudden influx of floaters. These are tiny specks or spots that seem to drift through one's field of vision. Many patients describe as seeing flashes of light. Imagine a fleeting lightning bolt in the peripheral vision. This subjective experience underscores the urgency and patients are seeking medical attention. These symptoms appearing abruptly and intensifying over a matter of hours to days. After several days or weeks, these symptoms will disappear. Besides the floaters and flashes, second most important and alarming symptom is shadow or curtain effect. This shadow often progresses towards the center of vision as the detachment grows. This curtain effect's alarming symptom and immediate intervention is required. Vigorous activities, such as heavy lifting or intense jarring, can exacerbate the symptoms. It often starts peripherally, on the edges of one's vision. As it progresses, the central vision can be affected, making tasks like reading or recognizing faces challenging. An iconic description is the tobacco dust appearance or Schaeffer's sign. This refers to the presence of pigment cells floating freely in the vitreous humor, a clear sign of retinal tears or detachment. Retinal detachment affects approximately 1 in every 10,000 people annually. To put it into perspective, that's about 0.01% of population. There are primarily 3 mechanisms of retinal detachment. Firstly, a rhegmatogenous detachment, which is caused by a tear or hole in the retina, allowing fluid to seep underneath and lift the retina from its foundation. Think of it as water getting beneath wallpaper. Secondly, tractional detachment, where scar tissue on the retina's surface contracts and causes the retina to pull away from the back of the eye. Lastly, exudative detachment, wherein fluid accumulates beneath the retina due to inflammation. Who's more predisposed to this? What are the risk factors? Nearsightedness, or minus in the eye. A history of retinal detachment in the other eye, cataract surgery, and physical traumas including different types of sports such as boxing and martial arts are risk factors. Age is an important predictor because the disease usually develops after 40. The gold standard of diagnosis is a dilated eye exam. An ophthalmologist administers drops to widen the pupil and then meticulously examines the retina. Computed tomography and ultrasound also can be used. The prognosis for retinal detachment largely hinges on its timely diagnosis and treatment. Nearly 85 to 90% of cases are successfully treated with a single surgery. And if it will be diagnosed and treated promptly, visual acuity can be saved. If diagnosis is delayed, then treatment is partially effective and visual acuity only partially can be restored. The duration of the detachment, location, and whether the central vision, macula, was involved play pivotal roles. If the macula remains attached, post-surgical vision tends to be superior. Initial management, especially in minor detachments or tears, might involve merely monitoring the condition. Various surgical interventions exist, tailored to the type and severity of the detachment. Procedures like pneumatic retinopexy, scleral buckling, and vitrectomy have showcased effectiveness. In essence, these methods aim to close retinal breaks, reposition the retina, and seal it to the underlying tissue. Aforementioned surgical procedures have illustrated enduring success, with most patients maintaining or regaining functional vision. However, a minor subset might need subsequent interventions. National Eye Institute elucidates advancements in bioengineered retinal tissues, and the promise they hold for retinal diseases. Also, stem cell therapy is under investigation as a potential remedy, focusing on restoring damaged photoreceptors. Retinal prostheses, colloquially dubbed as bionic eyes, aim to restore vision using an integrated system of microelectrodes implanted into the retina. On the genetic front, therapies are being developed to target specific genetic mutations responsible for some hereditary forms of retinal detachments.